Welcome to the IFord channel's presentation of the philosophy of solution. Today's feature offers an idea of how to make hospitals safer. Hospital-acquired diseases abound. One of the issues relating to the failure to prevent HADs is that people are looking in the wrong places for solutions and problem solvers are not involved. This is a result of very poor understanding of how to do things and get results. The world cannot wait for a solution. Time is of the essence. Antibiotic usefulness has a rather short time frame remaining. The end of antibiotic effectiveness is just around the corner. Because this problem has an urgency like no other, researchers or reinvestigators with open-ended efforts must not be allowed to control the pace of solution. Doers must take over the process of discovery, invention, and solution. Appropriate assets must be allocated in simple, standard, industrial planning must commence. The main profession that fits the process of discovery, invention, and solution is the engineering profession, not science, not medicine, not microbiology, and not pharmacology. Sure, these other fields can help, but they are not the drivers of success. If they were, HADs would not be a problem. In the United States, patients contract over 5,000 hospital-acquired diseases daily. Of these, almost 700 will die. But keep in mind, this is also an international problem with many, many victims around the world. Obviously, a multi-pronged effort must be undertaken to cure this plague. However, many of these efforts are doomed to failure. Creation of new antibiotics will only have a temporary effect and will eventually create even more devastating forms of disease. Our present appreciation of this problem says that new antibiotics will immediately be misused and, among other damaging effects, will contribute to the Clostridium difficile epidemic. This disease is commonly known as C. diff and is caused by high dosing of powerful antibiotics and is devastating to patients. There has also been a growing tendency to use genetic bacteria tracking around the hospital. This is mostly a waste of time. It can give information that is interesting, but not necessarily helpful and does not offer solutions. The solutions are already known. Genetic tracking might be useful as a quality assurance provision, but it is time-consuming with more interest to science than benefits to patients or staff. While ultraviolet light trees are available, the use of these devices show that the users have a poor appreciation of basic physics. UV is not ubiquitous and travels only in a straight line and leaves more pathogens than it kills. 5 minutes later, due to existing poor facility design and facility operating processes, new pathogens will quickly replace the old pathogens. The basics of engineering can be properly applied with immediate results for the healthcare system. Hospitals should be managed more like the technical facilities they must necessarily be. Solutions are available. Why aren't they being appreciated, understood, and implemented? The IFord Institute's mission is to educate professionals in order to end this dreadful problem. Inquire.